Well, in response to the changing demographics throughout the world, there are four fundamental things that we can do as a family, as individuals rather, as a family, as communities, as governments, and government policies. The first is the ability to detect early chronic diseases. The four major diseases of cancers and heart disease, respiratory diseases, are the types of things that if you can actually change your behaviors and the risk factors, like tobacco smoking, for example, can make a huge difference in ill health later on in life. So just the ability to target those diseases, getting individuals to change their behaviors, making medicines available, allowing people to learn of their potential risk. For example, diabetes is a major one where half the world's population does not know that they're at risk for diabetes, can make a huge difference. The second one is the age of life course, meaning that aging and healthy aging is not something you wait till at the very end of life. It is something that begins as a child, in the womb even, and goes throughout life, through adulthood. This involves changing behaviors, having healthy diets, having rigorous physical exercise, being able to make a difference that later in life people will be healthy and maintain those habits, and will make a huge difference in productivity at the end of people's lives. The third is what we call the age-friendly city. It's the environment in which we live and work. This means for the elderly to allowing them to have access to transport that's more friendly to them, the design of parks, the design of open spaces, how people actually can connect to one another. There's a whole series of environmental issues, health system issues, and how you actually design a community that need to come together. And the fourth and final one is how we actually think about the elderly ourselves, our attitudes, our stereotypes, and that we need to change those as well. And this takes time, but it is something that we need to begin. And this involves the fact that people are not a burden to society. It is not about inevitable decline. It is about productivity. It is about the fact that the elderly, as they are living much, much longer than ever before, can actually give back to society. And putting all of those elements together, which is really quite comprehensive, can really start to make a difference to think of the fact that in 2050, nearly a quarter of the world's population, nearly a quarter of the world's population will be over 60, which is really quite an extraordinary event in human history. And I think we will all benefit from that.